Hello, my name is Dr. Gelareh Sadigh, and I'm a radiologist and a researcher with expertise in healthcare delivery. I'm the study chair for a clinical trial called EAQ222CD or CostCOM. I would like to tell you about the importance of this study for patients who have been newly diagnosed with cancer and have just started their treatment. We are running this study because we want to see if giving patients an estimate of how much they'll have to pay before starting their cancer medicine makes it easier for them to stick to their treatment plan. We also want to find out if this helps lower their financial stress. Financial counseling will also be offered. Sometimes people stop taking their medicine or miss their doctor's appointments because they can't afford it. This study is testing ways to help patients avoid having to make those tough choices. If you have been recently diagnosed with cancer and have a new prescription for cancer medication, you may be eligible to participate. A patient who decides to participate in the CostCOM study will first meet with their doctor or nurse to review the requirements and discuss the benefits and risks of joining this study. This process is known as informed consent. Qualifying patients will then be assigned to one of two groups by chance. Patients in Group 1 will get a brochure from the Patient Advocate Foundation. The Patient Advocate Foundation is a national nonprofit organization. They offer free financial counseling and can also help people sign up for programs that give financial assistance. If you're assigned to this group, you can reach out to the Patient Advocate Foundation using contact details in the brochure and ask for their help. Patients in Group 2 will have the opportunity to attend 4 free one-on-one financial navigation sessions with a financial counselor. These sessions are 1 hour each and are set by TailorMed Medical Inc., a company that helps people understand medical costs and manage money.
During these sessions, a counselor will go over your health insurance details and give you an estimate of how much your medication will cost. Financial counseling will also be offered, as well as assistance with signing up for financial aid programs. These meetings will happen when you first join the study and then again at 3, 6, and 12 months after joining. You can choose to have these sessions over the phone or through video conference calls.
Participants in both groups will be asked to fill out surveys 4 times at study enrollment, then 3, 6, and 12 months after joining EAQ222CD or CostCOM. Each survey will take around 45 to 60 minutes and can be completed online or on paper. You do not have to answer any questions that makes you uncomfortable. Participants will receive a gift card upon the completion of each survey. Patients in Group 2 will also be asked to complete a 5-minute survey after each financial counseling session. The total time patients will be in the study is about 12 months. We may also ask some patients in Group 2 to participate in an optional interview within 6 months after they complete study follow-up. There is no extra medical care or testing being given as part of this study, and there are no expected costs to patients for taking part in this study. All information provided will be free. Approximately 720 patients with newly diagnosed cancer will take part in this study. They must also have recently started their medication or plan to start soon. Patients must be able to speak English or Spanish.
I know as a newly diagnosed patient, I felt my life was out of control. Anything that could help me regain my sense of direction would be important. Knowing the cost of my care and treatment, and that my insurance would pay for that care and treatment, would have restored my sense of security.
Research studies are an important way to test new alternatives in supporting people with cancer and hopefully to improve their care. To learn more about the CostCOM study, please speak with a doctor or visit the link on the screen.